devolution is about bringing together in Hackney, bringing together health and social care together. So they work much more closely together, but they also spend the money they have together much more closely. So, and Hackney decided to do this devolution pilot because it didn't want to be done to, essentially, because it was concerned that, you know, if it didn't get involved, things may happen that we would have less control over. And the other reason it wanted to do devolution was because it felt it had a kind of interesting health and social care economy, in the sense that it's got its own local hospital in the Honiton. It's got the city of Hackney CCG and the council who historically began to work quite closely together, looking at kind of issues about people who are vulnerable, people who are facing social isolation, people with dementia. With these kind of meetings, kind of trying to start a rolling programme of meetings that will allow us to kind of get people more in the swing about partnership working. So it's so we're hoping this will be kind of a big shift of the way things are being done in the borough at the moment. So we're also eager, do we need kind of volunteers to come and help us with these events as well? And also kind of tell your friends and family about these events, because we do want local people coming to these events. It's really important that we get a lot of people coming along and making sure that those who run the services recognise that there's a real appetite to actually talk about these sort of services. There's going to be less money about. It's going to be tougher on the voluntary sector, we believe, because they're kind of seen as the last people in line in terms of kind of potentially getting funding. And the services themselves are struggling in the sense that social care is underfunded.
Raise your voice. If you don't raise your voice, if baby doesn't cry, they don't give milk. Sorry about it. So we need to find the ways to make this. We need to invest some money to organize small events, to attract people, because some people say some of the communities, like Turkish-speaking community, they feel better in their organizations to talk about it. But if the organization doesn't represent them in this type of developments, so we are training our volunteers to go health and social care services or checkups, asking questions to the people, entering and reviewing what's going on, making reports together with Healthwatch Hackney.
Safeguarding is when you think of children and legislation, we've got something called the 4 areas of abuse in the children's world. What are they? Can anybody tell me what they are?
Neglect.
Wonderful. Neglect.
Torture.
Not quite.
Physical abuse.
Physical abuse.
Physical, mental.
Emotional.
So emotional. And then one more. One more.
Sexual.
Wonderful. Excellent. Now you'll never forget it. Think of the acronym PENS. I can't draw a pen, but that's what you think about. Instantly. In the adult world, there's one more area of abuse. And you know what it is? What is it? Financial. So there are a huge number of areas of abuse. The Care Act 2014 that has created, so previously we might have talked about, there wasn't a legislation like the Children's Act that governed what we did. Yeah, the Children's Act 2004 governed what we did. We had the Children's Act 1989, then 2004. In the adult world, we had an act that came into being in 1st of April 2014 that changed the way we did everything.
Why do we want to do adult safeguarding? Why am I doing this? Why is Christine here today? Why am I here? Why are we talking about adult safeguarding? It's the law. You have to, because it's the law. All of us around this table have a responsibility to safeguard vulnerable people. And it's legal. It's a legal thing that we all have to do. It's really, really important that we understand that they are at the heart of the safeguarding process. So the first key principle is empowerment. If you have a concern about a child or any child, and you are, for example, not at work, or you're not doing it through Healthwatch, and you're really worried about a child, you have to go through the London Borough of Hackney. You go straight to social services and you make that report, and you say, I'm really worried about a child, I think they're being abused or they're not being looked after well, and that's how you do it.
It's opposite hot. Hello.